So hi everyone. So this is VC Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we're going to see about the topic which is known as the benign prostatic hyperplasia. So what is benign prostatic hyperplasia? So the benign prostatic hyperplasia is nothing but it is a non-cancerous enlargement of the prostate gland in the male condition. So it is commonly seen in the older men, which can be obstruct the flow of urine due to the urethral compression. So what is the pathology for the benign prostatic hyperplasia means? So first one is the hyperplasia of the prostatic. It causes and the stromal and also epithelial cells which is gets into in enlargement. And then due to the enlargement, the formation of the large nodules in the periurethral region of the prostate, and it also leads to the compression of the urethra. So due to the compression of the urethra, there is an obstruction in the urinary flow, and it is also not considered as the precursor, and it is also not equivalent to the prostatic cancer. So generally, the benign prostatic hyperplasia is comprises of the three different types. So the first one is the glandular hyperplasia, then second one is stromal hyperplasia, and third one is a mixed type. So what is what is glandular hyperplasia means? It's nothing but an inflammation in the epithelial layer of the prostate gland. And then second one is stromal hyperplasia. It is nothing but the inflammation in the connective tissue. And the third one, mixed type, it is a comprised of both glandular and as well as also the stromal. So what are the causes for the benign prostatic hyperplasia? See, first one is aging. So the aging, old age plays an important factor mainly in the male, for common risk factor for the benign prostatic hyperplasia. Then second one is hormonal changes. So generally increase in the DHT hormone. So DHT is nothing but the dihydrotestosterone. So increase in these hormone can lead to the old age men to the benign prostatic hyperplasia. Then third one is genetical predisposition, and finally the inflammation and as well as also the oxidative stress over the prostate gland. So clinical features. So generally the clinical features for the benign prostatic hyperplasia are, first one is urinary frequency. So the urinary frequency alters comparing to the normal person and to the person affected with the benign prostatic hyperplasia. So the second one is nocturia. So nocturia is nothing but the urinary outflow during night period, which is known as the nocturia. Then the third one is hesitancy, and fourth one is weak stream and incomplete bladder emptying, urgency, and finally it is a dribbling. Dribbling is nothing but the droplet outflow of urine from the urethra. Investigative method. So generally, if the person is affected by the benign prostatic hyperplasia means, so there are different types of diagnostic tools which are used to identify that. So first one is digital rectum examination, and second one is prostate specific antigen test. Then third one is urine analysis. Fourth one is post-void residual volume by using the ultrasound scanning method. Then next one is uroflowmetry, and finally cystoscopy. So these are the some of the diagnostic tool which is used to measure whether the person is affected by benign prostatic hyperplasia. So medical management. So medical management for the benign prostatic hyperplasia are, so the first one is alpha blockers. So beta blockers are common drugs which are used in treating the cardiac patients. So likewise in the urinary flow incontinence patients, the main drug which is used to prescribe for them is alpha blockers. Then second drug which is known as 5-alpha residutase inhibitors. Then third one is combination therapy. Combination therapy is nothing but the drugs that previous drugs which is combinedly given to the person affected by BPH. And finally anticholinergics. So anticholinergics is nothing but if the inner layer of the bladder is getting affected or injured, so for treating that condition the anticholinergic drugs were being prescribed. So surgical procedure. So in the severe cases, the surgery is the only management for them. So in surgical management, first one is transurethral resection of the prostate. It is shortly known as TURP TURP method. Then second surgical method is by using laser therapy we can treat the inflammation of the prostate gland. And next one is in severe cases the surgically removal of prostate gland, which is known as the prostatectomy. And finally urolift and the RESUM, which is a minimal invasive method for treating the benign prostatic hyperplasia. So this is overall compression of the benign prostatic hyperplasia, and see you guys on next video. Thank you.